In terms of this entire process and how this came about, well, those questions do remain unanswered, and that pressure is mounting, particularly from opposition parties on the government, to clarify exactly how this position came about, who exactly signed off on it, and what exactly was going to be the funding model behind it. So Robert Watt, the Secretary General at the Department of Health here, is going to give a document information to the Health Minister today, explaining and outlining the entire situation. We understand this lunchtime that Stephen Donnelly has not yet received that document or that explanation, that he is awaiting it, and it could be later this afternoon or early into the evening before he gets the final draft, that final copy of that explanation. As I say, opposition parties, including Sinn Féin's health spokesperson David Cullinane, says there are serious questions that remain unanswered.
Listen, I think there are really, really serious issues in relation to the procedures and if these procedures were followed or not. And of course, there are questions which need to be answered, partly by senior officials in the department. But the person who needs to take charge here is the Minister for Health. He's the person who has to present this report to government. And this isn't the first time that we've had controversies in relation to public appointments. This is a cultural issue at the top of the civil service, but also one that the government is responsible for. They have to take responsibility, and they have failed to do so. And I think that the authority of the Minister for Health is clearly and rightly being called into question. And how can you have confidence in a Minister for Health to deliver on the big challenges in healthcare when you look at the incompetent way that he has dealt with this particular issue?
Well, Colette, colleagues in the Irish Independent reporting this morning that this document that will be given by the Secretary-General to the Health Minister will outline the fact that the funding model for Tony Holohan's secondment to Trinity College wasn't fully worked out, that's expected to be in that explanation, and to explain that the salary was going to be covered by a research fund. So that is the type of clarity that the likes of the opposition parties will be looking for this afternoon, to clearly explain how this happened. Of course, as you mentioned, Tony Holohan issuing that statement himself over the weekend, in which he said he decided not to proceed with this role, and he spoke about the fact that he looked forward to sharing his knowledge and expertise outside of the public service once he finished up here at the Department of Health in July. There's been a huge reaction to this, Colette. Obviously, a lot of people saying it's a huge disappointment that the public service would lose the expertise of somebody like Tony Holohan. Trinity College themselves issuing a statement saying much the same thing. It's a huge loss for Ireland's education sector and for all of the students who would have learned so much from Dr. Holohan's experience. But in terms of this process, how this has happened, David Cullinane saying that it's really important for the public to see full transparency around all of this, and we hope we will get that when the document is handed over by the Secretary-General to the Health Minister later today.